Welcome, everyone, and thank you for joining us for Food Fight, Three Diets from Cancer Dietitians. I'm Matt Labriola. I'm a medical oncologist here at the Duke Cancer Institute who works with patients facing genitourinary cancers. Today's conversation will explore three nutrition approaches that often come up in cancer care and survivorship that I'm always getting asked questions about in clinic: plant-based eating, ketogenic diets, and intermittent fasting. Our goal today is to help people better understand what these diets are, what the research suggests, and what considerations or cautions may be important. Before we dive in, one logistical reminder, we will have the opportunity to answer your questions at the end of today's presentation. So just please type your questions in the Q&A feature, and we'll do our best to respond at the end of the presentation. So we have three amazing speakers today, and Jessica, Keegan, and Savannah. I'd love to start by each of you introducing yourselves briefly and share the diet approach you'll be speaking about today. As a medical oncologist, I'm often seeing patients who are eager to hear practical, evidence-based guidance, so really can't wait to hear your perspectives.
Well, good afternoon and welcome everyone. And thank you, Christy and the Duke Cancer Institute's Supportive Care and Survivorship Center for having us. And thank you, Dr. Labriola, for moderating. My name is Jessica. I'm a registered dietitian here at Duke, and I work in research implementing dietary interventions for clinical trials. I am currently involved with an especially exciting trial looking at prolonged intermittent fasting using fasting mimicking diets in men with newly diagnosed metastatic prostate cancer called FASPRO. I'm excited to speak to you today about the different types of intermittent fasting in cancer treatment and survivorship.
Hi everyone, my name is Keegan. I'm a dietitian here at the Duke Cancer Center. I primarily cover GI cancers, birth surgery, and medical oncology, but I also see all other different types of disease states, and I have a very big passion for diets and oncology.
Hi, my name is Savannah Bowles. I am a dietitian here at the main campus cancer center. I cover melanoma, sarcoma, genitourinary, and lung cancers. And I will be speaking on the ketogenic diet.
Awesome. Thank you to all three of you, and we're so excited that you're here to teach us today. So let's get started talking about the ketogenic diet. In my clinic, patients with genitourinary cancers are often asking about ketogenic diets. They may be online reading about ketogenic diets and hearing about the Warburg effect, or this idea of, quote unquote, starving cancer. Savannah, can you start us off by just teaching us a little bit about the basics?
Absolutely. To kind of talk about the ketogenic diet first, we need to have a little bit of a biology lesson. I promise there will be no quiz at the end of this. But it was first described by Otto Warburg in the 1920s. And what he found was that most healthy cells efficiently produce energy by using oxygen along with other nutrients such as glucose and fatty acids. In contrast, many cancer cells rely heavily on a less efficient process called glycolysis. And that just means they're consuming large amounts of glucose even when that oxygen is present. And this phenomenon is known as the Warburg effect. And one way that I really like to explain this a little bit easier is with a car analogy. So think of cells use sugar or glucose the way that cars use gas. Healthy cells are going to be like a hybrid car. So think of like your Prius. These are fuel efficient and can use different energy sources effectively. Many cancer cells, on the other hand, are going to be like race cars. They burn through the fuel very quickly, particularly glucose, to support rapid growth and division. Although these approaches are less efficient, it can provide the building blocks needed for these tumors to grow. And think of like the race car having that exhaust. That exhaust produces an environment that allows the cancer cells to thrive in, as well as to potentially resist treatments.
That's fascinating. Thank you, Savannah. Thank you for sharing that. My understanding of the ketogenic diet is that it's high in fat, moderate in protein, and low in carbohydrates. On the next slide, can you walk us through what it looks like in real life?
Yeah, so the ketogenic diet was actually originally designed for individuals with epilepsy in the 1920s. And the ultimate goal of the ketogenic diet is to keep carbohydrate intake low enough so that our bodies can shift from using that glucose as its primary fuel source to producing ketones from fat. This metabolic state is known as ketosis. As you can kind of see here on the slides, I kind of give a little outline of a high fat, moderate protein, and low carbohydrates. And so, really, the biggest thing is just incorporating a lot more fattier foods. So, olive oils, coconut oil, full fat dairy products, fattier meats and fishes, and non-starchy vegetables. Really, just avoiding those really rich carbohydrates.
Got it. Got it. That's super helpful. And you list here, four different types of ketogenic diets. I see classic keto, MCT keto, modified Atkins, and a low glycemic index therapy. What are the differences between these, and why should it matter for our patients?
Yeah, so the biggest difference between all of these is just the amount of fat, protein, and carbohydrates that you're going to get with each one. So we have our more stricter classic ketogenic diet. This is going to consist of roughly 80 to 90% fat with only allowing 2 to 4% carbohydrates. So this is about a 3 to 4 to 1 ratio of fat to carbohydrates. Whereas if we move down the line, we have our medium chain triglyceride keto. A third to two-thirds of your diet is going to be made up of MCT oil. And this is going to allow you to incorporate a little bit more carbohydrates and foods that you enjoy. And then our modified Atkins is going to be our less restrictive, more flexible. It's like a 1-to-1 ratio of fat to carbohydrates or a 2-to-1 ratio. And then lastly, we have the low glycemic index therapy. And this is really focusing on low glycemic index carbohydrates or foods that raise your blood sugar more slowly and causing less blood sugar fluctuations. So this would be a great trial per se with someone with diabetes. But overall, I recommend, if any of these are of interest, is speaking with a dietitian prior to starting any type of ketogenic diet.
Got it. Thanks, Savannah. Thanks for laying out all the percentages too. That's super helpful for our listeners. So yeah, in clinic, kind of the buzzword is always about like, quote unquote, starving the cancer, as I had mentioned before. On the next slide, can you tell us like, what would you want patients to understand about that phrase of starving the cancer?
Yeah, so the biggest thing is, the concept sugar feeds cancer can be so confusing and misleading. And all of our cells, yes, all of our cells are going to use glucose for energy. This includes our cancer cells, this includes our healthy cells fighting the cancer. Even if you said, Savannah, I am never going to eat sugar again. Your body is going to find a way to make that, whether that be through ketosis or another process. But what happens is when our body is going to make it from another way, it is going to pull from our lean muscle mass. It's going to deplete our immune system. It's going to make treatment a lot more difficult, which is really the last thing we want during this time. So really the biggest thing with this statement is it's more important to be mindful about the amounts of simple sugars that we're eating. So your white breads, your cookies, cakes, things like that. This is because when you eat a lot of sugar, your body produces a lot of insulin, and that insulin can actually tell our cells to grow. For healthy cells, this is great, but to encourage cancer cells to grow, we don't really want that, right? So we need insulin, but too much isn't always a good thing. It's about what and how much carbohydrates that we're eating, not about starving our cells of its main fuel source. We get so many benefits from eating carbohydrates, and Keegan's really going to dive into that when she talks about the plant-based diet.
Thanks, Savannah. That's a nice segue into our next session on plant-based diet. So let's shift over to Keegan. So many of my patients are also asking me about plant-based diets, and whether that's for overall health or specific for cancer risk reduction. Keegan, can you tell us a little bit about plant-based eating and what that means in the context of cancer care?
Yeah, so plant-based diet, I like to say, is kind of more of an umbrella term. We see that with that being said, like this, it's really the increasing of plants consumed throughout the day. Plants are so beneficial for us, they're so necessary for us. And so when we see in this plant-based diet, we see two different types of main diets that fall under this umbrella category. And most people are common and familiar with this, and this is the vegetarian vegan diet. There's one big difference between a vegetarian vegan based diet, and that is animal products. So vegans don't consume any animal products, which is similar to vegetarians, but they also don't consume any animal byproducts, and that's kind of that key difference. Animal byproducts are typically all dairy products, things that animals produce. So milks, cheeses, all those fun things, as well as sometimes it's kind of a debate in the vegan community about honey, since that is a byproduct of bees. Some vegans won't consume it, some vegans will. It's really your preference. But mainly, these two plant-based diets are very similar and the fact that they avoid all animal products, I said, which is, beef, poultry, pork, fish. So that is not the primary source of protein. With a plant-based diet, in that umbrella term, you can consume kind of that moderate amount or that smaller amount of these animal proteins. Something that I feel as a professional is Mediterranean diet kind of falls under this. And Mediterranean diet does kind of tier the different proteins. Whereas these both plant-based diets are really big on not are avoiding those products and really emphasizing the increase of fruits, vegetables, whole grains, legumes, and then in that vegetarian area, that dairy products.
Got it. Thanks, Keegan. Thanks for covering kind of the differences between vegetarian and vegan eating. That's super helpful. And just to reemphasize, you're talking about, focusing on fruits and vegetables, whole grains, legumes, and then you said dairy. Just can you highlight again, just like what does like a balanced plant-based pattern look
Yeah.
like for someone? Yeah.
That is such a great question. And really we'll go into it a little bit later, but like, creating your own plate is very unique to yourself. And what I said kind of about a plant-based diet is just increasing that focus on plants, right? Making sure that we're having that diversity throughout the day. Typically, I like to tell my patients a general goal to shoot for is three different vegetables daily and two different fruits daily. I like to say that we are not perfect. I recognize we're not perfect. I don't always hit that goal daily, but that's kind of the generalized goal. Usually trying for one type of fruit and one type of vegetable at every single meal is usually a great goal. And while you're building that plate, really, the difference between a plant-based diet and like a typical Americanized or like animal consuming diet is the central concept of the plate. So in a plant-based diet, really we're focusing on those plants, right? The main dish on that option is the plants, and then secondary would be the protein, and secondary would be like the carbs. So with that being said, I usually recommend shooting for 50% of the plant being vegetables, 25% of it being protein, and 25% of it being those other carbs, not the complex carbs that kind of Savannah was talking about. So that's usually how I recommend it. So instead of like, so focusing on getting a big piece of steak, mashed potatoes, and broccolis, instead increasing the broccolis, making that the primary subject of the plate, having that mashed potatoes, and then maybe adding some more protein, which could be like lentils, chickpeas, and then having that chicken or that steak.
That's super helpful, Keegan. Thank you for reviewing that with us.
Yeah.
Yeah, so I guess like my patients are always asking about like what else do I need in my diet, right? We hear about fiber and
Mhm.
phytochemicals and antioxidants and other vitamins and minerals. And I think on the next slide we'll talk about, those things. So can you tell us why are those nutrients important for cancer patients?
Yeah, so this is a really big topic. And if you've ever talked to me before, I'm a big fiber nut. That's like the main things that I talk about 24/7. If you hear anything, take anything away from me, it's fiber. And in this plant-based diet, because we're prioritizing plants, because we're increasing that diversity throughout the day, we see general increase of that fiber, those vitamins, antioxidants, everything that you mentioned. The reason that we emphasize and see so much benefits from it is because fiber does a lot of things in our body. It delays gastric emptying, which means that it keeps the food in our stomach and it slows its transition into our intestinal tract. That's super essential for multiple reasons. One, it keeps us fuller longer so we don't see overeating. Two, it helps regulate blood glucose levels so that people that are have type 1 diabetes, type 2 diabetes, it's a great way to help manage it through, diet. As well as it helps manage and regulate bowel movements. I know, unfortunately, that's kind of a common side effect that we see with people during active treatment, after active treatment, surgeries, et cetera, et cetera. So really making sure that we increase in that fiber can help with regulating our digestive tract. Antioxidants are very amazing. They're super good with helping with fighting inflammation and systematic inflammation. So consuming that kind of that baseline can help with like, whether that's like a knee pain or, we're recovering from surgery. These are all great things to kind of help with that inflammation, as well as vitamins. We see kind of people through active treatment, post-treatment, surgery. Sometimes we see very commonly deficiencies. And by increasing those plants throughout the day, they have all these vitamins, so we don't have to supplement and worry about these deficiencies.
Got it. Thank you, Keegan. That's
Of
incredibly
course.
helpful. And this caught my eye in your slide as someone who treats patients with prostate cancer. I give a lot of hormonal therapies, and we're dealing
Mhm.
with, decrease in muscle mass and increase in fat. And you note here that, plant-based diets may reduce the risk of obesity, cardiovascular disease, type 2 diabetes. What makes this pattern kind of appealing from a long-term health perspective?
Yeah, great question. So, kind of like I was saying with that fiber, when we're prioritizing plants on the plate and we're increasing that fiber, it helps with maintaining weight status and like regulating blood glucose levels, which by maintaining weight status, we don't see that obesity. It's very common, like you said, with hormone-based treatments that we see sometimes a weight gain. So, whether we're in active treatment, versus survivorship, it's a little bit different, the discussion around weight, which is perfectly fine. But really, like maintaining our weight status, staying within normal kind of body requirements and weight status is very essential to decrease obesity, which we know is a common factor that can increase diagnoses as well as reoccurrence. Increasing kind of these plants and that diversity as well is very good to help with regulating and decreasing like um, fats. We see a lower fat intakes, prioritizing plant-based fats, which is super beneficial for like cardiovascular disease. So people who consume this plant-based diet have decreased cardiovascular disease problems, which again is very beneficial in decreasing exposure, reoccurrence, diagnoses of cancer. So just because we see so much benefits of that plant-based diet, of increasing that diversity, consuming that, making sure that we don't have deficiencies, etc. We see that just really we limit the potential like chronic diseases or the potential things that can increase reoccurrence by diet and by that control factor.
Got it. Thanks, Keegan. See, this is why at Duke we love working together, right?
Yes.
Working with our expert dietitians, we can improve outcomes kind of across both cancer itself and also long-term health. So thank you so much for sharing that. So yeah, I guess the last question in this section, I just want to ask, like, a lot of people think plant-based automatically means healthy. What are some common pitfalls that people run into when they hear about plant-based diets?
Yeah, it's funny. I'll kind of counteract you when I talk about plant-based. A lot of people are like, does that mean I have to eat salads every day? And I'm like, no, it does not mean you have to eat salads every day. I promise, I'm not eating salads every single day. I don't want to eat a salad every day. If you like that, respect and all for it. But it's really like I keep harping on it. It's that diversity, right? When we have both a regular animal consuming based diet and a plant-based diet, we can find those niches where we just get in the rut and we eat the same thing over and over again. And that's not that diversity that I'm talking about, right? Like, yes, you have to be a little bit more intentional with creating your plate. You have to be a little bit more intentional with like designing meal plans and grocery shopping, which I can understand can be a little bit of a barrier. But that's what we're here for, right? We're here to help you. We're here to alleviate that stress, make these things, these changes a little bit easier for you, and kind of talk these things through. Slow and steady wins the race, in my opinion.
Thanks, Keegan. We're so thankful to have you on our care teams. So let's shift gears here and talk a little bit about intermittent fasting. This is a topic that comes up very frequently in my clinics, patients asking particularly about ways to support their health either during treatment or shortly after they get sort of treatment. Jessica, can you teach us a little bit about intermittent fasting?
Sure. So, the type of intermittent fasting that I hear most people trying is time restricted eating. This is when you limit your eating to a daily window, like 10 or 12 hours, and then you fast the rest of the day. There's also 5-2 fasting, where on 2 non-consecutive days a week, you consume around 25% of your normal calories, and then the other 5 days is usual eating. These types of intermittent fasting could potentially reduce the risk of recurrence by suppressing the growth state, by lowering average levels of blood glucose, insulin, leptin, insulin-like growth factor, all of these which are associated with cancer progression in either human or animal studies. And they can also support our body's innate cancer-fighting processes as well. There's also alternate day fasting, where you eat normally one day and then fast the next, and so on. This can provide weight loss, but has mixed results in other markers of health, like blood glucose, insulin sensitivity, and cardiovascular risk factors. So if you're thinking about trying intermittent fasting, maybe skip that one. There's also prolonged fasting, where you fast for 2 or more consecutive days in a row. So 2 days in a row or more. However, water-only fasting can be unsafe. It can be dangerous. And so researchers will often use a fasting mimicking diet. This is a specially designed low-calorie plan that provides some nutrition while still providing the benefits of a true fast. And what you're seeing on this slide right here is a picture of 1 day of everything you might consume on one of these days of a fasting mimicking diet plan. So prolonged fasting can provide all the benefits that we discussed already, slowing the growth state, supporting your body's cancer-fighting processes, but it can also protect healthy cells from treatment and sensitize cancer cells to treatment. This includes chemotherapy, radiation, immunotherapy, hormone therapy, and others.
Thanks, Jessica. You talked about the different types of fasting, time-restricted eating, intermittent fasting, and how they're associated with weight loss, improving insulin resistance. If you just had to pick one thing, what really stands out the most for our cancer patients from the impact of these?
So lowering those insulin levels can really potentially reduce the risk of cancer recurrence and slow progression. And this was seen in a study of women with breast cancer. In addition, lowering oxidative stress, supporting a healthy gut, can also help lower inflammation and lower cellular damage, which could reduce cancer risk. In addition, though, some cancer treatments might put people at higher risk for things like weight gain, insulin resistance, cardiovascular disease, as you mentioned, Dr. Labriola, and intermittent fasting could also help mitigate those metabolic side effects from the treatment.
Got it. Thanks, Jessica.
More than one
And you also, yeah, absolutely. Yeah, and you also described, prolonged fasting or fasting mimicking diets as an area of active interest, that it can possibly increase sensitivity of cancer cells to our treatments, increase the protection of your healthy cells, which is super exciting. Yeah, how should patients think about that information today?
Yeah, great question, because the evidence is promising, but it's still ongoing. Much of the evidence we have is from preclinical trials. Those are trials that are done in cell lines and animal studies. And there are some human trials, mostly in breast cancer. But what we do see in these preclinical and clinical trials is that the subjects, whether they're mice or humans, often do have better tolerance to treatment with less side effects. Of course, that would lead to better outcomes and better quality of life, very importantly. Overall progression-free survival is frequently increased in these trials. And while studies are showing that intermittent fasting and fasting mimicking diets are safe and feasible for most people, we don't yet have enough human data to know if fasting mimicking diets are safe and effective in all cases. So more research is necessary. So if you're interested in fasting, the most important step is to talk to your oncologist. There are some people for whom fasting might not be the best or the safest or the healthiest. So for example, if you take certain medications like insulin or have low blood sugar, if you have had recent unintended weight loss or struggle to eat enough, intermittent fasting is probably not for you. Ultimately, Intermittent fasting and fasting mimicking diets aren't a magical intervention that will cure or improve therapy against all cancers at all stages. So, for example, if a standard therapy is expected to bring excellent results, fasting mimicking diet might not be warranted, and you can focus on other evidence based lifestyle interventions. And some people also might just not want to fast, and that's okay.
Thank you, Jessica. We're so appreciative of your efforts in the research space and kind of bringing us to the forefront of our patients. So thank you so much. So we've heard a lot of really amazing information. All of these sound really attractive. So let's try to compare them. I'm seeing patients in clinic and people are asking about what are the pros and the cons of these different diets. So can we help? Let's try to help them clarify how they differ and what they should be keeping in mind. So Keegan and Savannah, if someone's on active treatment versus survivorship, how does this conversation differ? Maybe Keegan, we can start with you.
Yeah, so I kind of hinted just slightly about how, like, during active treatment and survivorship, that there's a little bit of energy needs difference. I mean, they're not too significant, but there's just little different things that you're going through. When you're going through active treatment, you're getting chemotherapy, immunotherapy, possibly surgery. So that's increasing your energy needs internally, meaning that, we need to eat more, we need to consume kind of more throughout the day. And then in survivorship, that's when we can kind of, focus on the additional things. I know when you get like a cancer diagnosis, it's almost like your life stops and turns 360, and you're like, oh my gosh, all these other things that I was focusing on have just pushed to the side and are focusing kind of on this right now in this moment, which is fantastic and is great. So when we move into survivorship, that is when we can kind of switch the gears just slightly and discuss, additional things. That's when we can talk about obesity and how to work with that, or increasing physical activity, or like I said, increasing the diversity of plants throughout our day. Those are when we can kind of shift just slightly. But in the end, these diets are fully recommended before, during, and after active treatment. Just because of those, reduced risks that we said to obesity, cardiovascular disease, diabetes, etc.
Savannah, do you have anything to add to that helpful advice?
Yeah, so kind of just hitting a little bit more on what Keegan said, she did a great job. Overall, just as a dietitian, our biggest goal in both active treatment and survivorship is to help keep you as healthy and strong as possible, with nutrition. During active treatment, our priorities may shift a little bit from what you are actually eating to how we can improve your quality of life. Through nutrition, patients may experience, symptoms of taste changes, nausea, vomiting, difficulty swallowing, or may even need a feeding tube. And we work closely with you and your care team to kind of help manage these symptoms. Whereas in survivorship, we're kind of walking alongside you and giving you the tools and the evidence-based science to help you make lasting changes to your diet that's still going to allow you to incorporate the foods that you love while feeling your best.
Got it. Thank you both. So yeah, there's global advice, but then also this kind of individualized approach. So appreciate both your perspectives on that. One thing I think we should discuss, and people get diagnosed or they're going through treatment, they hop online, they're searching for information, whether they're using AI bots or looking on social media, right? And a lot of these things are like very absolute, or they're promising these great promises to treat cancer. Jessica, what should people be like cautious about when they're reading about nutrition advice online?
So, the evidence we see from clinical trials is that dietary interventions like fasting are effective in the treatment of cancer when combined with standard of care treatments, not when used alone. Also, more is not always better. So, for example, with time restricted eating, fasting windows that are 14 to 20 hours may be problematic. For example, people who skip breakfast and fast daily for 16 hours have higher LDL cholesterol, that's the bad one, higher rates of diabetes and heart disease, and even increased mortality. Interestingly, higher risk of hospitalization for gallstones. So it's really important to look at what's coming out of trials to help inform our choices. It's really easy to get caught up in I see this with time restricted eating. Like, if some is good, if some fasting is good, more is better. But when we actually look at the data, that is actually not the case.
Got it. Thank you. Super, super helpful advice, Jessica. So we appreciate your perspectives. So we've learned a lot about the advantages of these different diets. Let's talk a little bit about the disadvantages, right? In clinical practice, what I'm worried about, what my patients are worried about is safety and practicality, right? These are some top priorities. So let's talk honestly about the downsides and the risks that some of these diets might pose for cancer patients. So Savannah, what are the biggest practical or medical concerns that you would want to us to know about in terms of the ketogenic diets?
How much time do I have? Just kidding, just kidding. So really, there's a lot of physical and mental disadvantages with the ketogenic diet. So for starters, with from a mental standpoint, there's social isolation. Going out to eat, enjoying a cookout with friends. Those are a big part of your cancer journey and your support system. And so that might create some social isolation. You might start to fear food or develop an eating disorder. It's very time consuming with having to be precise with weighing your food and making sure you're getting enough fats and limiting those carbohydrates, and it's a really rigid diet to have to stick to. As far as the physical elements of this that, can be affected is it can cause dehydration. Low insulin levels on the keto diet can cause the kidneys to excrete more sodium and water, which is something we don't want. We're having increased intake of saturated fats and processed meats, which can increase our LDL cholesterol and increase risk of heart disease and strokes. Also, it can increase risk of kidney stones. Also, some studies suggest that extreme carb restriction during treatment involving any type of steroids could affect your blood sugar regulation, not to mention vitamin deficiencies, weight loss, muscle mass loss, and it can cause a lot of GI upset as well. This just may not be appropriate depending on kind of your treatment course and what you've been through. And so, just with it being so restrictive, it could exacerbate a lot of these additional symptoms that you had been experiencing.
Thanks, Savannah. That was a lot of information, very concisely, so we appreciate it. Keegan, so for plant-based eating, what are the main nutritional concerns that our patients should plan around, particularly as it comes to like proteins and micronutrients?
Yeah, it's such a great question. So a lot of the things when it comes to plant-based diet, as I kind of mentioned and hit on it a little bit earlier, is like intentionality. You have to be very intentional in planning your meals, and you have to be very intentional in going to the grocery store, which it's just something that you have to do when you first start out. Once it gets easier, then it's kind of, second nature, but that can be a really big barrier, creating a really big learning curve, which I know can deter a lot of people very quickly. As well as I know this economy right now, all of our grocery products are, the prices are raising. So I recognize that that could be kind of a barrier to intake, it might cost a little bit more for a lettuce versus some ground beef, and I recognize that. So that can be a huge barrier, as well as because we don't have a full protein source like a beef or chicken breast, etc., that we can kind of sometimes see lower protein intake over out through the day. And like I said, it's very essential to make sure that we're having high protein while we're going through active treatment and recovery process. So that being said, you just kind of have to consume a lot more of things that have different protein sources like nuts, legumes, chickpeas, soy, and all that. As well as, just like any other diet in this, world, we see deficiencies. So sometimes a plant-based diet can be a little bit more deficient in vitamin D and B12. So you have to be a little bit more intentional with that. As well as because we're not having salmon frequently, there sometimes can be a deficiency in that omega-3 fatty acids. So again, have to be a little bit more intentional with that, as well as zinc and calcium. Dairy contains those a lot because, vegans, not vegetarians, don't consume a lot of dairies. We just have to be a little bit more intentional with these kind of deficiencies that we can see. It doesn't mean every single diet's going to lead to that, but these are some patterns that we can see through this process.
Thanks, Keegan. I appreciate you calling attention to cost. I feel like that's something that's often overlooked, and we want to be patient centered, and these factors are really important when we're discussing this topic. So thank you for addressing that. And then Jessica, for intermittent fasting, what are some of the biggest barriers that you see in real life, both like physically and socially? Oh, I think you're muted.
Sorry, fasting is not without potential side effects, although these vary depending on the type of intermittent fasting. But the most common are low energy and headaches. There's also a possibility of episodes of low blood sugar, lightheadedness, even a possibility of fainting. There is less risk with time restricted eating as long as that fasting window doesn't get too big. Remember, keep it around 12 to 13 hours. Socially and mentally would be the more difficult piece, similar to what Savannah was saying about the ketogenic diet. If you're restricting, you can miss out on some social events that involve eating. And then, mentally, you might have some temptation. Who in your household is cooking food and making coffee that you can't have, depending on the type of fasting, of course, that you're choosing. So really, with all dietary patterns, just consider how can it fit into your lifestyle, consider your priorities, your support system, and yeah, use that to help guide your choices.
Got it. Thanks, Jessica. So I've learned a ton. I'd love to, close with some final thoughts. As someone seeing patients in the cancer center, when I'm giving medical advice, I know how important it is to have, clear, kind of practical guidance. So, what is the most important message that you all hope patients take away from today's conversation? Keegan, let's start with you.
Yeah, so really what I want to highlight, plant diversity. That's really all it is, right? I don't want you to change. I don't want you to go into your or your pantry right now, take everything out and say, I'm starting fresh and starting new. That's not what we need to do. Start slow and steady. I like to tell people, the 80-20% rule, adhere to it 80% of the time. Try your hardest 80% of the time, then 20% fun. It doesn't need to be a complete fix. Start that snowball, get it going. Once it becomes easier, we can build on it. But start with different ways that you can increase vegetables. If breakfast is not the meal that you have vegetables in, see how you can figure out how to add it in. Sweet potatoes, spinach, onions. Vegetables are very easy to find. They're a little bit weird. Sometimes you have to learn how to cook them, and I totally understand that. But that's what we're here for, right? We can take here, we can set goals with you, we can work alongside you to kind of see all these health benefits that we're talking about. Make it easy for you.
Savannah, what about you?
Yeah, there is so much on the internet about the benefits of doing the ketogenic diet, especially through cancer treatment and post-treatment. But it's important to understand that carbohydrates are not the enemy here. The number of times that I've gotten, Savannah, I can't enjoy that piece of birthday cake, because it's going to fuel my cancer. It breaks my heart because that is something that we should be able to enjoy. There's not one diet or one food that is going to cure cancer. We live in a world right now where we want a miracle diet, even if that means sacrificing the foods that we love. But that's just not realistic and quite frankly enjoyable. So working with a dietitian can help you understand the importance of nutrition during whatever stage you're at in your cancer journey. We can be your internet mythbusters and help you know the evidence-based research from the misinformation. And just for my last point, please enjoy that piece of cake.
Thank you, Savannah. I think my patients needed to hear that. Jessica, bring us home with your takeaway there.
Yeah, here. I'm all for that. I'm all for that cake. Yeah, so, well, fasting's not really a diet, so you can combine it with any way of eating if it was something you wanted to incorporate. But again, I just want to reiterate, if you are in active treatment, please discuss with your oncologist if it's right for you, right? If you're interested in trying any form of intermittent fasting, or if you're interested in learning a little bit more about the FastPro trial that I work on. But again, just want to point out intermittent fasting is not really great for people who have unintended or rapid weight loss, or malnourished, or have very low body weight, or are currently struggling to eat enough, right? It's probably not right for you. And really, when you're thinking about trying any specific dietary approach, don't forget to include the evidence-based recommendations that we really heard from Keegan, right? Well, that's one of them, but eating plenty of plants, right? Fruits, vegetables, whole grains, beans, and exercise, because what you eat is just as important as when you eat.
Thank you, Jessica. I appreciate you guys highlighting those final things about each of these diets. So I do want to just come up with some practical takeaways for patients. Our goal here at Duke, right, is to help patients find safe, realistic nutrition strategies that would fit their unique needs. So, Keegan, across all of these approaches, how important is it to individualize nutrition recommendations based off their particular diagnosis, what treatment they're getting, what symptoms they're having, what current weight changes they might be experiencing, or even personal preferences?
Yeah, I think it's super important. One of my things that I like to tell patients is in the oncology space, we really show how uniquely created we all are. What works for one person doesn't work for the next person, et cetera, et cetera. Some people go have this chemotherapy and get this side effects, and they don't get this side effects, and all this stuff, it's exposing how uniquely created we are, and that's beautiful. I think that we should take that and we should run with that, and we can, set everybody has different health goals. Body weight is not always a reflection of health, right? What you're feeling, how you're feeling. When you're in active treatment, your health goals may be, I just want to be able to walk up the stairs not being winded. When we're in survivorship, it may be, I want to run a marathon. These are all different goals for health-wise that we can also tailor when it comes to nutrition, right? What we eat is very different. We have different cultures, right? Food is culture, food is family, food is connectivity. These are all multiple factors that make food so special to us. And really, what I want to say is let's keep it simple. Let's work together. I can go within your lines, you can go within my views, we can work on that together. And that's really it's beautiful. Food should be fun, it should be easy, it should be not as stressful as it sounds and how the internet makes it be.
I love that. Thank you, Keegan. Food is beautiful. I agree. Savannah, if the listeners today are anything like me, they're like taking copious notes, and there's all this information that they just are trying to download. So if someone's curious about one of these diets, like what's the safest first step?
Yeah, that's a great question. I think the greatest first step to do if someone is interested or wanting to potentially start one of these diets is to talk with your provider, your oncologist, to get a referral to speak with an oncology dietitian. Kind of like what Keegan was saying, we are uniquely and beautifully made. Your nutritional needs are going to vary from the next person depending on the type and stage of cancer you have, current treatment, your body weight, muscle mass, medications you've been on. We take all of this into consideration. It's not a one dietitian fits all, one plan fits all. We kind of get to know you on a personal level to help kind of meet you halfway. And all the way, we'll meet you in the OTC. We'll meet you wherever you are to be able to talk with you and come up with the best plan for you. But we're here for you to support you through your journey. And us dietitians here, we love talking with patients.
Thank you, Savannah. I couldn't agree more. So Jessica, for someone on the call today who doesn't want to follow a particular strict diet, what are just a few evidence-informed nutrition habits that can still support their health either during or after cancer treatment?
Well, at the risk of sounding repetitive, one of the best things we can all do is eat more plants. So I encourage you to ask yourself every day, every meal, how can I add more fruits, vegetables, whole grains, nuts, seeds, beans to my plate, right? The other is not nutrition related, but it's exercise. It's really one of the best things you can do before, during, and after treatment. As Keegan was explaining, it might look different depending on where you are in your journey, but just remember that some is always way more than none.
Thanks, Jessica. I'm gonna play this for my kids. Maybe they'll start eating more vegetables.
Yay.
Really appreciate it. So let's shift over to our Q&A. So we do want to take your questions. I will say if your question is very personal or detailed, our panelists may answer in a more general capacity. That would just be more receptive to the entire audience. We do encourage you to speak with your care team or your dietitian directly if you have a very specific question, because as always, individualized recommendations are best, particularly for those experiencing cancer. So there is a function at the bottom of your screen where you can type in questions, and we'll field those for you. So really interesting question coming through. This can be for anyone who may have expertise in this. Can anyone speak to an alkaline diet? Um, this viewer has heard that cancer can't live in an alkaline environment. So, any advice?
That's really interesting point that has been brought up. I'm gonna be honest, with the current literature right now, it's not been discussed enough to really see yes or no. I think that we're talking about literature, we're talking about science, and I think these things that are up and coming is fantastic. Something I like to tell people is when you think about the technology and the science evolution that we've had, we've exponentially grown within the last 250, 300 years, right? And so we're now just slowly catching up. Just as much as there's new chemotherapies coming out and there's new immunotherapies and surgery techniques, there's new nutrition and like discussions around nutrition. So what we can say right now is there's not enough evidence to say yes or no when it comes to this, but that's something that we're working on the back end, right? That's our job. We're sitting here, we're reading scientific journals, we're understanding different, methods, different things that are suggested. I don't see any harm in trying to work alongside a dietitian with that and kind of discussing. But what we'll do really is kind of identify, when we see some red flags coming up, when we see some things like in labs or weights or not, that's when we can kind of, hey, maybe we shouldn't exactly, keep going with the style that we're going with.
Thank you, Keegan. That highlights such an important topic. Just like there's a lot that we still don't know, and more that we need to learn. So thank you so much for sharing that. One person is curious. Yeah, is there short recipe documents anywhere that can be recommended for intermittent fasting or like the Mediterranean diet? Jessica, do you know if there's any pre-made documents on intermittent fasting?
I don't know about pre-made
Okay.
documents on intermittent fasting, but
Fair.
I'm not sure what the if the participant is or if the participant is asking for like guidance on timing or on what. And I'm sorry, I don't know about recipes for the Mediterranean diet, but I imagine it's plentiful on the internet.
Gotcha. It's okay. Um, this person must be a Mythbusters fan. So they're curious is if there's like one nutrition myth that each of you wished would go away, what would it be? Thank you for that question.
Sugar feeds cancer.
Yeah, I'm gonna second that with Savannah. Sugar feed cancer, like she said, all of our healthy cells need sh like glucose, right? And I like to tell people, when I have this example, I usually give three examples, right? We have a piece of cake, we have a whole grain piece of toast, and then we have an apple, right? When we eat these three things, because they're all three carbohydrates, they break down into glucose in the end of the day, right? But when we eat the apple, in addition to eating the glucose and getting the carbohydrates, we're getting fiber, which is super beneficial, like I talked about multiple times. We're also getting antioxidants, which I talked about helps with fighting inflammation. Same thing with the whole grain toast, right? We're getting fiber because we're having the whole grains in it. We're getting other like minerals and vitamins in that too. And then when we're eating, I mean, in the end of the day, when we're eating the chocolate cake, fully agree with Savannah. I like to tell my patients we eat the chocolate cake for vibes. In my opinion, that there is two types of foods. We fuel food that fuels our body, and there's food that fuels our soul. And it's okay to fuel our soul. It's okay to enjoy what's in front of us. with no regrets, that's going to be better than, hating the salad in front of you.
Love that. Jessica, any other myths you want to bust?
Well, I third sugar feeds cancer, but to have um, to bring in another one, I don't know if this is a myth, but more is not always better when it comes to nutrition. So I right like so for example, with the fasting, right? If some fasting is good, more is better. That's not the case necessarily, right? So, food is really important to eat. And I'll just say this one thing that if you do time restricted eating, I see a lot of people like extending their morning fast into the afternoon or evening, but the evidence shows that the benefit is best when we eat in the earlier part of the day. Just to hit on that.
Thank you, Jessica. This is a very real question, so appreciate this one coming in about like kind of taste changes with therapy. So before this individual had chemotherapy, they really enjoyed green juices, they enjoyed salads, and then after chemotherapy and radiation, they're disgusted to even think about a salad. Is that something that's normal, or are they kind of alone in that?
Yeah, I definitely think that is something that is normal and that we see on a regular basis. Your taste is changing just like your body going through treatment. There's a lot going on, and your taste buds are going along for the roller coaster ride. So, definitely, it is okay if you find salads disgusting. My biggest recommendation that patients kind of look at me funny when I recommend is to avoid your favorite foods when things aren't tasting great. And they're like, why? Because they're my favorite foods. I said, exactly. Because when you get your taste back, you might get an aversion to them. And we don't want you to have an aversion to your favorite foods.
That is super helpful advice. I'm gonna make sure I work that into my discussions as well. Um, this is an interesting one. Is it good to eat dark chocolate for antioxidants?
100%. What I like to tell people too, just in general, when it comes to like sweets, if you're craving a sweet, statistically, we see the first bite of anything that we eat is the best bite. And then afterwards, it exponentially gets worse. So if you are craving something sweet, I would love for you to prioritize like a dark chocolate. I don't see a square as a big deal at all. Those are fantastic. Has great antioxidants. My only little bit of tidbit about that is if you're experiencing some acid reflux or you're experiencing some stomach discomfort, it may trigger it just a little bit.
Thank you, Keegan. I'm a big dark chocolate fan, so I totally second that one. So this question is more about supplements. So, this individual has heard about apple cider vinegar, taking that like a tablespoon of that daily, or chia seeds with Greek probiotics daily. There's a lot of information about supplements out there. Are there any particular recommendations that you guys would want to share?
Yes, I talk about supplements a lot. I typically, when it comes to supplementation, and I'm pretty sure Savannah could echo this and will echo this, is we don't like to prioritize supplementation. We really want you to prioritize it through baseline diet. That's why I said the plant-based diet is so beneficial because we don't have to supplement. While we're in survivorship, the conversation is slightly different than active treatment, just because, we're not having as much chemotherapy or other medications we're taking. While you're going through active treatment, I like to say, our dietitian team, as well as the chemotherapy team, the pharmacist, and the med-onc team provider, we all work together to make sure that any supplement that you're taking doesn't interfere with the chemotherapies and immunotherapies. That's our biggest concern going through active treatment. We want the medications to work as they're intended to work, and we don't want to add additional things to kind of interfere with that pathway.
Yeah, and kind of touching a little bit more on that, Keegan did a great job. As far as like specifically with this patient, the apple cider vinegar daily, usually I will say with things like that, try and make it into like a salad dressing or mix it into something because that's a really acidic food and that can kind of cause burning and to our lining in our esophagus and in our stomach and cause some upset stomach or reflux. And so we kind of want to avoid that, but I definitely understand wanting to do the vinegar for benefits. So yeah, trying to mix that into something. And then the chia seeds with Greek yogurt is a great way to get some probiotics in as well as fiber and keep you full and for longer.
Thank you both. For those who, want to learn more about these topics, are there any particular books or websites that you would trust that could be helpful for our viewers?
I think one of my favorite websites is the American Cancer Society. They have a lot of great recipes and just information on there. You have to be a little bit careful of where you're getting your information from. We actually have a resource for patients that has provides a list of trusted sites and books for you. The biggest thing is like watching out to see, does it say .com, .org, things like that, making sure it's a reputable site.
Yeah, and to kind of second what Savannah says is we just kind of want to highlight that, all three of us have gone and got additional education in nutrition. So we all got master's degrees in nutrition, and we've done like internships and studied, medical practice of nutrition. And we have licensing, so that's what makes us a dietitian. So usually what we recommend if you are looking on the internet, or if you are communicating with other people, that you look and make sure that they have adequate licensings and degrees to speak on nutrition. Not that everybody's uniquely created, everybody has their own opinion, and I think that's perfectly fine. But I usually recommend if you are looking at some additional resources, making sure that it's registered dietitian approved.
Couldn't agree more. They know so much more than me. That's why we work together, right? To take care of you all. So let's end on this one because we're running up on the hour. A few days after chemotherapy, oftentimes drinking water leaves a bad taste, and it's hard to like actually get hydration and electrolytes in. Do you guys have any tips on ways to improve hydration and make sure we're maintaining electrolyte intake?
Yeah, so for that specifically, water's not going to be our only hydrating source of fluids. If you're doing milk, yogurt, puddings, jello, popsicles, broth, things like that are going to be equally as hydrating as just doing water. And you can always add fruits, the packets to your water. A lot of people like the liquid IVs or Gatorade, Pedialyte. You can even make those into popsicles, which is great. If you're doing any type of nutrition shake like Ensure or Boost, those are great ways to continue to stay hydrated. Even if you're eating like bananas and pretzels and things that have a lot of those electrolytes already built into it, there's no need to worry as much, about the hydration or the electrolyte aspect of that. We typically recommend 64 ounces of fluids a day, just as a general recommendation. Obviously, it's more specific when we're looking at your labs and seeing where your electrolytes are.
Yeah, and just to kind of second act that is, you can also eat your hydration. So watermelon we know is high in water content, cucumbers, celery, all those things. So those are different ways. Usually I typically recommend like flavor packets to go into water. A lot of my patients say too, after chemotherapy, they really bounce back when they get that fluid hydration, their IV hydration. So being really intentional before and after chemotherapy with the different fluids that you're drinking, can also benefit from like rebounding and feeling great. I mean, Savannah covered it all very fantastically, like she always does, but these are just some additional ways. And that's something too a dietitian can chat to you about. We can chat about strategies to hydrate, different ways to get electrolytes in, et cetera, et cetera.
Thank you so much. Just want to say thank you so much to our panelists, Jessica, Savannah, Keegan. Thank you so much for sharing your expertise with us today and helping us better understand these nutrition approaches and a balance in a really thoughtful way. So thank you so much. I learned a ton. Today's conversation really reminds us that nutrition and cancer care is complicated and it's not a one size fits all approach. And the best plan is one that is safe, that is sustainable, and that is individualized. Thank you so much for listening.